Hair is very important both in terms of self-esteem and for creating one's self-image. However, when anomalies are noticed, the instinct is to turn to the hairdresser to find out which shampoo can help or to the pharmacist for advice on the best supplements. Yet, the dermatologist is the person to turn to when there are doubts about hair health. The specialist is the only person able to understand if there is an underlying pathology behind the hair loss, and can intervene promptly with the appropriate therapy before the problem becomes serious. Not only that, they can also reassure the patient if it is a temporary disorder and teach them how to manage it, even by slightly modifying their lifestyle. When should you have a trichological consultation? Visiting a dermatologist is essential when you start to notice increased hair loss, when the scalp is flaky or intensely itchy, or when the hair is thinner and duller. In addition, it is important to have a consultation in case of androgenetic alopecia, baldness, present in the family. The specialist will then investigate the causes of hair and scalp anomalies and, in the case of androgenetic alopecia, can determine if the person has inherited a predisposition to this condition. In the case of a family history, it is important to have a consultation around the age of 18 to 20 when androgenetic alopecia, especially male pattern baldness, begins to manifest. The specialist should also be contacted in the case of temporary disorders, such as seborrheic dermatitis, dandruff. How does a trichological consultation work? The trichological consultation takes place in 3 stages: anamnesis, objective examination, and dermoscopy. In the anamnesis, the specialist collects the patient's data to identify which factors may have influenced the problem, such as heredity, lifestyle, intense stress, medication intake, recent infectious diseases or surgeries, postpartum. The objective examination involves inspecting the scalp to see if it is red and/or flaky, and then evaluating the condition of the hair, whether it is shiny, dull, or split. At the end of the objective examination, the pull test is performed, which involves pulling strands of hair from the frontal, parietal, and occipital areas. If more than 6 hairs come out, the test is considered positive and the presence of abnormal hair loss is deduced. The last stage of the examination is dermoscopy, during which a special lens is used to inspect the scalp, which allows for the detection of a series of pathologies and disorders, such as eventual hair thinning, miniaturization, caused by the shrinking of the hair follicle, typical sign of androgenetic alopecia. In dermoscopy, flaking around the hair follicle, parafollicular keratosis, which is a sign of an inflammatory disease, follicular lichen, which causes scarring of the follicle, can also be observed. In addition, in case of black dots at the hair follicle or very short hair, with a thick shaft, signs that the hair is somehow unable to grow, one could be facing alopecia areata. Alopecia areata is an autoimmune disease in which antibodies are produced against the hair follicle, preventing hair growth in some areas, alopecia patches, but can also affect other hair areas, beard, eyelashes, eyebrows, etc., or even the entire scalp, total alopecia areata, or the entire body, universal alopecia areata. After the 3 stages, all the necessary information for an accurate diagnosis and the prescription